Hey guys, I think we're going to make a start now. For those of you who don't know me, my name is Dylan. I'm the head of professional services in Pharma Plus. Uh, Welcome to this webinar. I can see that there's a few new faces here, so welcome. A couple of things really, and this is going to be the first one for the summer. Sorry, let's start again. This is the first one that we've done since the summer. We normally take a little recess during the summer break because obviously people are on holiday, and the last thing they want to know about is these sorts of things. So this is the first time we're doing it after we get back, after we've gone through after the summer holidays and that. The other thing is that we tend to do this every month as well, so it tends to be on the last Tuesday or the last Thursday of every month. So if you enjoy what you hear today, if you learn something from today, then by all means feel free to come to the next one, and that will be next month around about the same time, the last Tuesday or Thursday of the month. A couple of rules really. I am recording this, and there's a reason behind it. We record this and put it onto our website afterwards. So if you catch something, or if you don't catch something, you can go back and sort of re-listen to it. The other thing about it as well is that you can also, I'll give you my email address. It's system, at pharmaplusltd.co.uk. That's if you want to email me about any questions, and feel free to do so, or alternatively our telephone number in your office is this. Again, feel free to give me a ring should you need that as well if you miss out on something. Okay, so I'm going to make a start today. I anticipate that we're going to be in this probably for about 15 to 20 minutes. I don't think we're going to take up the whole of the 45 minutes. And the other thing is that I can see that most of you have got microphones, so if you want to ask any questions, by all means interrupt me whenever you want to. On the corner as well, there's actually a chat line as well. You can type in your question if you don't want anybody else to see what you're writing as well, or what you're asking. So you're more than welcome to use that as well. So feel free to interrupt me. Now, I'm going to make a start on this now. Now, as you can see, I tend to do this slightly differently to many other presentations. I tend to use what is called the mind map. Sorry, it's not very clear. Is that the sound? Can you hear me better now? Okay, I'm going to carry on. If you can't hear me properly, just let me know. It might be, I don't know, I can't, there's nothing else I can really do. Can everybody else hear me? I think I'm getting everybody else being able to hear me. If you can check your sound on your computer, it might be that. Okay, I'm going to carry on. Okay, great. Yeah, I'm getting other people who can hear me clearly. I think it might be your computer or your speakers that might be at fault here. So have a look at that. Yeah. Okay, I'm going to make a start now. As you can probably see, I do these presentations slightly differently than just boring old PowerPoint presentations. There's a proper mind map in place, and this actually helps to ingrain what it is that I'm going to be saying to you. It's much easier rather than going through slide by slide by slide. If you want a copy of this as well, we'll send it out at the end of this as well, so you can have it posted up, or you can print it off, or you can do whatever you want with it as well. Okay, so the topic of today is we're going to be talking about flu. Not colds, mind you. We're going to be talking about flu, and there's actually a difference between the two of them. We're going to be talking about when flu occurs. We're going to be talking about the national targets. We're going to be talking about the different types of flu. Believe it or not, there are different types. We're going to be talking about how long it takes to get the symptoms, and how long it becomes. You might become infected, but it might take a while for those symptoms to come out. We're going to be talking about what flu feels like. In other words, what the symptoms of it are. We're going to be talking about the treatment. So this is going to be taking up the most time for obvious reasons. And what I've also done today is that I'm going to try and dispel some of the, how to describe it, some of the sort of like the non-evidence-based remedies that are out there. And believe me, there are a lot of remedies out there. What I did is that I did a quick Google search on something called flu remedies, and you'll be surprised with what you'll find out there. And my job today is to sort of give you an idea of what you should be saying to your patients and what you shouldn't be saying to your patients as well. Bear with me 1 second. Sorry about that. My daughter just walked in on me just now, and I've asked her to. Okay. Anyway, let's start. There's a difference between cold and flu, and you will know which one you've got. However, patients tend not to realise the difference between cold and flu. A cold is, majority of the time, a patient will come in with a cold. They'll say they've got the flu, but the majority of the time they've got a cold. A flu, basically, you will know whether or not you've got the flu. You're essentially bedridden. With a cold, you're not. You just have a little bit of a stuffy nose. You're generally high and fine. The flu will knock you for 7. In actual fact, you'll probably be bedridden for a few weeks. And that's one of the reasons why flu, or treating flu in the early stages through vaccination, and we'll come on to treatments in a bit, is really important, because if you can prevent flu from really attacking you, in other words, if you're vaccinated, if you've got the immunity behind you, not only will you be much better off in terms of much healthier, but also in the wider context, it will have a much lesser impact, I should say. That doesn't sound very good English, but it'll have a lesser impact upon the economy as a whole. So basically, just to let you know, there is a difference between the cold and flu. You will almost certainly get most patients coming in with cold. There will be a few patients coming with flu as well, but we'll talk about that a bit later as well. Now, so hopefully that's giving you an idea of the fact that the cold and flu are completely different things. Now, let's go on to what we're going to talk about now. Let's go on to different types. Now, there are different types of flu, just as for example, there are different colors of cats, there's different species of dog, there's different types of flu, and they generally tend to be subdivided into 3 different categories. You've got the A's, you've got the B's, and the C's. Now, I'm not going to go into this in any main detail. It's just for you to, just really for your reference, if anything. The main ones that you're going to be treating in the pharmacy are the A's and B's. These are the ones that tend to cause the seasonal issues. In other words, these are the ones, if I open this one up, that tend to come up every November and every November and October. So what you'll be finding in the pharmacy, again, is really not going to have any impact upon how you treat them, but you're going to be finding these people are going to be having the A's and the B's. The C's is slightly different, nothing major again, but that tends to be a different subgroup of the flu virus. But you'll be treating mainly these categories here. Now, the reason why I went into tiling is that flu tends to occur at around about the same time each year. It's not to say that flu suddenly disappears after December. It's still there. But the reason why it tends to occur around about this time is because everybody is huddled together. It gets cold. You put the heating on. You close the windows. And what happens? You sneeze. And what then happens, it's much easier for it to get from one person to another person in a very confined environment. So hence the reason why it tends to occur in the winter months. It doesn't mean to say that it suddenly disappears. It means to say that this is the time when human beings are closer together physically so that the infection can actually spread. Now, in a couple of weeks' time, there's also HUD. I believe that's in October, in actual fact. And this is another time where, for example, infectious diseases can actually transmit very easily. You're going to have a lot of people in one place, in a very small space, in one country. And hence, there's a much greater likelihood that you'll be getting these sorts of things there as well. So, in actual fact, that coincides around about this time as well. There's 2 very important dates that you need to bear in mind whereby this sort of transmission is possible. So Hajj and also in October and November tend to be the times when you're going to get quite high transmission of this. And the reason why I mentioned Hajj is that it's in a couple of weeks' time and something for you to keep in the back of your mind as well. Okay, so that gives you an idea of where. Oh, by the way, in the southern hemisphere, you'll find that this is inverted. In other words, it tends to be the cold months down there, which I think is around about May, where you tend to get flu, tend to crop up around then. So it is very much dependent upon the weather. Okay, I'm going to turn everybody off at the moment unless there's any questions, and just put your hand up or just type in your question. Okay, it's just easier for me to do it that way. Now, the targets. The UK, in actual fact, sorry, England, I should say, has got quite a high target. In other words, we're trying to get up to 75% of at-risk groups vaccinated. Now, at-risk groups tend to be adults, not adults, but elderly, over 65, for example, people who are immunocompromised. In other words, patients who have a low immune system, people who are on many medications, those sorts of people. We're trying to get at least 75% of those people vaccinated. And there is a reason behind that. Remember, I mentioned about the fact that it will knock you for 7 and also has a huge impact upon the economy. And that's the reason why vaccination is really quite important, because it will help to minimize the impact that this has during the months of October and November. Now, what I'm going to go over now is the incubation period. Now, it takes time for you to show your symptoms. You can, for example, be close to somebody who's got flu and not realize it for up to a few days. It takes around about 1 to 3 days, plus even, for the virus to grow inside you and to multiply inside you, and then for you to show some of the symptoms of flu. And as mentioned earlier, it's spread by waterborne droplets. So, for example, when you sneeze, it is transmitted very easily through the air and into the nostrils of somebody else very close to you. So during that time there, you'll be infectious. Probably for another couple of weeks after that, you'll be infectious as well. There's quite a long period of time whereby you can infect somebody else. But this is this is something that you need to bear in mind. You might not necessarily show the symptoms immediately. It will take a few days for something like that to come up into those symptoms to come up. Now, what I'm going to concentrate mainly on is the symptoms, and I'm also going to talk about treatment now. Now, there's 2 different types of symptoms. Believe it or not, flu can be quite dangerous as well. And you probably, for those of you who've been around for a few years, you're probably well aware of the swine flu epidemic that occurred, or pandemic, I should say, that occurred a few years ago. There's also variations of the flu in say, for example, the avian flu virus as well, and so forth. Now, the reason why it can be dangerous is because of these sorts of things here. I'm not going to go into the technicals behind what this means, but you just need to look at this word here, meningitis and encephalitis. They look quite dangerous words, and they are. And flu can potentially create these sorts of conditions in the body, in actual fact, life-threatening conditions. And hence, one of the reasons why pandemic flu, in other words, the swine flu epidemic and the avian flu, that's the reason why they're looking into it with a lot of caution, simply because of the fact that because the flu virus is so infectious, it could quite easily transmit from one person to another. And if it creates these sorts of symptoms on a regular basis, it could be very, very dangerous to a population as a whole. I'm not going to concentrate on this. If I'm going to close that down, you'll be glad to hear. I'll be concentrating mainly upon these ones here. These are the common symptoms that you would like me to hear. The main one is fatigue. You're going to be, as I said earlier on, not for 7. You're probably going to be bedridden for quite a while. But a lot of the time, it's not going to be the patient who comes to you. It's going to be one of their relatives who comes to you and asks you for advice, because the patient is at home in bed, probably with a water bottle in their bed as well. You've got other symptoms here. You've got fever. That's a very common one as well. You've got the sore throat, you've got runny nose. I'm sure you can think about this. There's also another one called gastrointestinal disturbances. So these are disturbances of the stomach area and the intestinal area. Vomiting, for example, is actually a very common form of it. I don't know if you've heard of gastric flu, but that's actually a very common symptom of that as well. So all these sort of symptoms, as you can probably see, you can probably treat most of these in the pharmacy, and most of you probably know what you can treat them with. So let's talk about the treatments now. Now, there's 3 different types of treatments, and what I'm going to do is I'm going to be concentrating on the OTC remedies, but I'll be touching on these 2 here. There's a different type of treatment called antivirals, and it's a POM, which basically means prescription-only medicine, and you guessed it, it's available only on prescription. And you've also got vaccination as well, which I'll touch upon as well, but I'm not going to go into too much detail here as well. So let's pop up the ones which I'm not going to go into too much detail in there. So I'm going to go to vaccination. Now, vaccinations occur at the same time each year, around about this time in actual fact, and hence the reason why we decided to do flu as one of your topics. The flu vaccines are actually being delivered as we speak. This is the time when they're going to be delivered. This is the time when pharmacies and GP surgeries and clinics are going to start vaccinating individuals. It's a very, very effective way of stopping flu. But it's not treating the flu. It's actually giving you a dose of the flu, a very, very small dose of the flu, a very inactivated dose of the flu, so that your antibodies, in other words, your resistance to the flu when you're actually exposed to it, will help you to prevent you from getting the infection in the first place. By the way, if I'm going too fast, please feel free to stop me anytime. As I said, there's a chat window there. Just type in your question. Now, the thing with vaccination is that it requires specialist knowledge. In actual fact, pharmacies do vaccinations, and they will do vaccinations, and it is probable that your pharmacy will be doing vaccinations in the near future as well. So it's important that you get a fairly good idea of what this entails as well. The pharmacist is going to be the one who's going to be doing the vaccinations. I doubt very much you will be doing it yourself because it's not something that will be under their direction. But it's important that you know about the fact that they will be doing it in your pharmacy, or very likely that they'll be doing it in your pharmacy. And they're available in 2 different forms of vaccinations. They're available under the NHS to the risk groups that I mentioned earlier. So, for example, the over 65s, the people who are immunocompromised, the people who are on multiple medications, as an example. There are other groups as well. And if you're in the London region, interestingly enough, the London region of the NHS has commissioned many pharmacies to provide the flu vaccination service in your pharmacy. So if you're one of the ones which are doing it, you will know about it, and that's basically under the NHS. They commission you as pharmacists to do that, or as cancer systems to do that. There's also another type of vaccination called a private vaccination. Now, this one tends to be taken up slightly less, obviously because the patient themselves will have to pay for it. On the NHS, you get the NHS to pay for it. As a private, the patient themselves will pay for it. And that's the people who are not in the risk groups, who are not going to be under the directions of the NHS, but they are willing to pay for it themselves. And there's slightly different conditions that need to be met from them. The problem is that I can't go into these conditions with you because it varies per provider. But just bear in mind that there's 2 different types of vaccination: there's the NHS and the private. But it's likely that if your pharmacy is doing the NHS, it's going to be doing the private and vice versa as well. So the vaccination, as a summary, is the best way of preventing you from getting the flu. It's not a treatment. So it's not something that stops you from getting the flu or reduces the symptoms once you get the flu, but it's to prevent you from getting the symptoms in the first place. It's to prevent you from becoming infected significantly in the first place. Now, I'm going to touch on this one here, the antiviral. As you can probably see, it's antiviral. In other words, because flu is a virus, if you take an antiviral medication, the theory is that it should kill off the virus. Unfortunately, it doesn't work that way with this particular one. It's not a very effective remedy. In actual fact, it's a very ineffective remedy. It was given out, for example, in the pandemic situation that occurred a few years ago. I don't know if you yourselves probably got it, maybe took it, if you remember that. The problem is that well, what it really does, it technically it reduces the time, the symptom times. In other words, if you are infected for 2 weeks, it will reduce it by a day or two. So it will reduce it by maybe to 12 or 13 days. There's not a huge amount of, reduction in time, but it does, however, theoretically help the economy to recover. So they're not doing it for your benefit, they're doing it mainly for the economy's benefit. So if you can reduce the amount of time people are sick by a day or two, then hopefully they'll get to work quicker and it will help the economy as a whole. So in that sense, antivirals themselves are not very effective. Now, if it's not in a pandemic situation, which we're not in the moment, it's only used generally in secondary care, in other words, in hospitals, under very, very special circumstances. It's very rarely used in primary care. In other words, it's very rarely used by GPs in the community. So it's very unlikely that you're going to get a prescription for an antiviral, such as Tamiflu, for example, in the community, in your pharmacy. And that's probably one of the reasons why I haven't seen them very recently either. So these two, I hope I've given you a very brief indication here. I'm going to go into now some of the over-the-counter remedies which you're likely to come across. And that's right, these are the ones as counter assistants, you're most likely to give out to your patients. So they're going to be, I've sort of categorized it into various different areas. So for example, you've got decongestants, you've got paracetamol, cough remedies, and you can probably see that I've got an X and a tick next to them, and I'll go over why I've put that in a minute. Sore throat pastils, inhalants, vitamin C, and there's other bits and pieces around as well, which I'll go over with you as well. The ones with ticks tend to be the most effective. The ones with the crosses tend to be the least effective, or very little evidence to go with it. And let's go into decongestants. Now, decongestants examples are, and I'll show you some pictures in a minute, things like Sudafed, things like Actifed, for example, contains it. Danus contains it. Most of the cold remedies, Lemsip, for example, contains it. Or most of the brands of Lemsip contain it anyway. Most cold remedies, most flu remedies contain a decongestant. And the idea behind a decongestant is you probably don't need me to tell you. I don't need to teach you stuff eggs, but it's to dry up the nose. There are a few things that you need to bear in mind. Again, I'm not going to go into the details, but they do interact with quite a few medications. So if you've got somebody who's got flu or who's got a cold even, you need to check to make sure that they're not taking any other medicines. And it also does react with a few medical conditions as well. So, for example, if they've got heart conditions, if they've got what's the word I'm looking for? High blood pressure, for example, you might want to ask them just that as well. So if they've got any other medical conditions. Actual fact, there's another thing as well, which I didn't mention earlier, which I should really be putting on here as well, is that there are actually pack size restrictions for something called pseudoephedrine. I think that's how you spell it. Okay, there's actually a pack size reduction. Believe it or not, this particular drug, which is found in Sudafed, can be converted quite easily. I'm not going to tell you how you do it, but it can be converted quite easily to amphetamine, and that's the reason why they've actually restricted the pack sizes. So if people are asking for a lot of pseudoephedrine, you need to just keep your ears peeled on that. By the way, so just be careful of that one. So it gives you an idea. So Sudafed, for example, Actifed, and a variety of other cold remedies contain a decongestant. Now the good old paracetamol, this is my favorite, and is very effective, very, very effective. It's very good at reducing fever, very good at reducing pain. Obviously, there is a maximum dose issue. So in other words, don't take more than 8 doses generally if you're an adult in 24 hours. Remember that there is also a number of different remedies which contain paracetamol. So, for example, you've got Lemsip, you've got Danus, for example, both contain both contain paracetamol. So you've got to be acutely aware of the fact that a lot of people possibly don't know that these remedies contain paracetamol. So they could be taking Lemsip and then double up, for example, with Danus, in which case they'll be doubling up on paracetamol, which is not a very good idea. Too much paracetamol is very bad for you. So just be aware of people asking for too many cold remedies, or just warn them when you're giving something out, like Danus, not to take any other paracetamol as well. And also there's a pack issue as well, like the Sudafed up above. You're limited to the number of pack sizes or packs that you can give in one go. Alright, so that's paracetamol. Very, very effective. Very, very good as well, as is the decongestant. Now, I'm going to leave cough remedies just for a moment. I'm going to come up to sore throat pastils. So you've got things like Strepsils, you've got things like Pyrazex, you've got things like Dequitaine. Very good, again, if you've got a very sore and swollen throat. Another good one is aspirin, in actual fact. Or ibuprofen even as well. These are anti-inflammatories. They're not actually pastils, they're anti-inflammatories, much similar to, similar in the pain relieving properties of paracetamol, but these two here are very good at relieving sore throats, in actual fact, they reduce inflammation as well. But the pastils, you've got the Tyrozex, you've got Dexpain, which you can give. Generally, no issues giving that out. There are obviously issues with ibuprofen and aspirin in sore throats and in pain relief. Again, just make sure that you're not taking any other medication. Another very good one is the inhalant. I'm sure you've seen things like Vicks, the little bottles of Vicks with the menthol and eucalyptus. I think there's Olbas, that's another one. These sorts of things are very good, generally at opening up the airways and soothing the nose as well. It's very good in actual fact something to put in something called a steam inhalation. Now, what a steam inhalation is you put a drop or so, for example, of Olbas oil in hot water and inhale the steam. And the idea is that it opens up the airways because the Olbas does that. But at the same time, it gets rid of all the mucus in your chest as well. Very effective, a little bit cumbersome, but very effective. Now I'm going to come across these on here. You can see I've got an X next to all of these. Cough remedies are not very effective. In actual fact, you'll be very unlikely to see a cough remedy being prescribed by a GP. And that should give you an indication as to how ineffective they tend to be. Things which are for chesty cough are practically useless. Dry coughs tend to be slightly okay. You've got Fulcadine, for example, that's okay. You might get that prescribed for the, I think I spell it. That's a good one for a dry cough, but for chesty coughs, they're practically useless. So just bear in mind, cough remedies, yeah, you might get patients asking for it, but the research underneath it for chesty coughs in particular suggests that they're useless. So bear that in mind when you give out cough remedies. Now I'm going to come on to some old wives' tales. Vitamin C, very little evidence behind it actually working. Actually, there's practically none. So I don't know where this came across. It's not something that you should be promoting for colds and flu. It's not something that generally works either. Although it's in folklore really. It's really nothing, not much behind it. It's just that vitamin C actually works in flu. And another one, I think I spelled it right. Echinacea. Again, absolutely no evidence that it works. You're going to get a lot of people saying it does, but the research again suggests it doesn't. And again, you shouldn't be promoting this in your practice for the treatment of flu. Now, what I've done, I'm going to pause there for a minute or two. Does anybody have any questions so far? If you want to, you can type it in, or you can just unmute yourselves and ask. Okay, I haven't got any questions so far, so I'm hoping that people have understood what I've said. Now, what I've done is that I've done a Google search on flu remedies, and let me just open it up, and you'll see what I mean. Okay, right, now, what I've done is that I've typed in flu remedies, put it into Google, And this is a list of things that have come out. So, and I quite like this in actual fact, because it gives you an idea of what people are thinking in terms of flu remedies and the sort of things that come out. So, for example, you've got lemons. Remember I talked to you about the vitamin C issue. That's the first thing that came out on Google, believe it or not. There you go. You've got some nice little cold remedies. I did see a picture. There you go. Sudafed, the decongestant there as well. And you've got some really bizarre things going on. I think I saw some onions and garlic here. Heaven knows how that works with flu. You've got, for example, here we go. Nice hot drink. That tends to soothe the throat. You've got some really bizarre things. Hold on, if I can find some. God knows what these things here are. Okay, let me see if I can find it. There was a nice little picture with a number of cold and flu remedies that I saw earlier. Onions, again. I mean, I don't know what this is. Oh, by the way, flu can be quite dangerous in pregnant women. So if you're pregnant, or if you've got a patient who's pregnant, and then you need to check with a pharmacist here. So just bear that in mind there. Ginger, that's another old wives' tale. Heaven knows how that works. Here you go. Here's some of the sort of like remedies that you can possibly give. I did see a really nice one earlier. Never mind, I can't see it. Here you go. Bending cold and flu. Beecham's is another one. Tomato soup. Well, it won't help with the flu, but it certainly helps to soothe your throat. There you go. C500. That's actually vitamin C500. But if you look on the internet, you're going to see a whole variety. The reason why I did this is that you can see a whole variety of weird things that people actually put on that they think that actually helps with cold and flu, but in actual fact it doesn't. I'm seeing if there's anything else before I sort of switch this bit off. I don't know what Mr. Sad's doing here. Okay, let's see what else there is. There you go. You've got Lancet. Okay, but anyway, so I'm hoping that you can actually see that there's a lot of misinformation on the internet. So don't take that as your only source. The only thing I can say is look at the treatments that you've got here. Look at the remedies that we've discussed earlier. Think about what we've just said as well. And just be careful of what you actually promote as well. So hopefully this has given you a little bit of a better understanding behind flu. We're sort of like running out of time now. I'm going to open up the floor to questions now. So if there's anything anybody wants to ask, just unmute yourself. There's a chat function as well. So if you've got any questions, just ask. No problem. Thank you. Somebody just said thank you. Okay, I don't think I'm going to get any questions here. Okay, so this is going to be. So this has been recorded. It's going. Did somebody want to ask something?
Yes, please.
Yeah, go for it.
Decongestant and asthmatic. Is there any connection? Do we need to check on that if they are on inhalers?
Not really, is the answer.
Okay.
The thing is that sometimes what happens is that the flu itself can trigger wheezing. So you need to be careful with that element. But generally, you know, that they tend to be fine.
Okay, so no advice as such.
Sorry?
We don't need to give any advice.
Well, I mean, I think you need to sort of like say something along the lines of, you know, a lot of the time with influenza, it can trigger an asthma attack of some sort. So you need to just let the patient know that if they are wheezing, then they need to possibly increase the doses of their inhalers, because that's going to open up their airways quite well. But in terms of blocked nose, no, not really.
Okay, thanks.
Yeah. Okay.
Yeah. Thanks.
Good. Okay. Anything else?
No.
Oh.
Thank you.
No problem. Okay, so this is going to be. Oh, why are those people at higher risk? Good question. Basically, from what I gather, the flu itself actually attacks the respiratory system. It increases things like mucosal secretions. In actual fact, it can trigger an asthma attack simply because of the fact that it's attacking the respiratory system. I'm not sure about the intricacies of that, but it's just something for you to bear in mind that these people tend to be slightly more at risk of some sort of asthma attack associated with this. Okay, so I've had two questions. Anybody else want to ask anything? Okay, I think that's it then. Okay, so this is going to be posted up on the website. So thank you again for attending, and hope to see you again very shortly next month. This mind map as well will be on the website. If, however, you want it sooner rather than later, you've got my email address. That's about, you just email me at this email address, and I'll forward it on to you. Or you can contact our office on this number, and we'll email it to you directly today if you want to. Okay, so I'm gonna switch off. Oh, one other thing, we are doing another webinar this evening. This is going to be slightly different in the sense that we're going to be concentrating on combined oral contraception. I chose this one particularly because of the new year starting and to get people thinking about this now. This is actually going to be a lot more clinically orientated. So if you are up for it, you're welcome to attend. But this is being designed more for pharmacists. So that's actually going to be at 8 o'clock this evening. So if you have got any time you want to come along, feel free to do so. Okay, so, and if you do want to come along, again, contact this number, here we are, contact that number and we can send you the link for that one as well. It's not on this particular link that you use. Okay, so I'm going to call this, put this to an end, and thank you again for coming, and we'll see you very shortly. All the best. Have a good day, yeah? Take care. Bye.